So you could see like this butterfly. Okay, I think there may be some points for you to take, like the honey in the flowers. And I think I may not keep you long. I know everyone slowly must be started feeling their anger pranks this time. And I know there's one more speaker waiting behind me for the next talk. And I think one needs to understand the principle of development. For understanding the development and the red flags, I know it's continues from consumption to maturity. The sequence of development is same in all children, but sometimes the rate varies. This needs to be understood. The rate varies. It is intimately related to the maturation of the nervous system. Generally, the mass activity that is seen in utero and soon after birth is replaced by specific individual responses, and the development takes place in the cephalocaudal directions. And there is a big role for primitive reflexes that are present in these babies that has got to lose or get integrated as the milestones are achieved. So what do red flags actually mean? Red flags actually mean indicators that denote that there is some developmental problem. So the most common presentation would be a failure to achieve an age-specific appropriate developmental milestone. One needs to also be careful about some of the babies exhibiting delay and some babies having a little bit of deviance from the normal. And one needs to keep this in mind before labeling any baby as a developmentally delayed baby. And also look for patterns. There are patterns in most of these conditions like intellectual disabilities, cerebral palsies, hearing or visual impairments, or autism. Some of them show patterns, and as you are surveilling this baby and doing screening, you will sometimes observe patterns that help us to clinch the diagnosis. Now, there are certain indicators that gives clues as to which of these babies may probably need a surveillance and are vulnerable for developmental delays. Abnormal fetal growth, which are growth restricted babies in utero, babies who had fetal distress, extreme preterms and including early preterms, extreme low birth weight, including very low birth weight babies, any baby who's had an UPGAR of less than 3 at 5 minutes, any baby who has had an hypoxic ischemic encephalopathy at birth, or a baby that has had recurrent apnea requiring frequent resuscitation. These are all babies that probably are babies vulnerable for developmental delay or some neuronal damage, and that needs constant surveillance to pick them up early. And some of the other clues are if a baby is born with club feet or spina bifida or arthrogryposis or Down syndrome, these are also babies that needs to be followed up closely for developmental delay, or these are all indicators that that baby may have some developmental delay or developmental disability. There are certain factors that we see in the neonatal units that warrant surveillance later. A refractory shock, refractory seizures, a baby that has been treated with prolonged sepsis and meningitis, a baby that has had high bilirubin and gone in for kernicterus, any baby, especially preterm, that has shown ventriculomegaly, cystic periventricular leukomalacia, hydrocephalus, or an abnormal neurological examination at birth. These are babies probably vulnerable for neurological disability. These are some of the early red flag signs that probably will give you clues in the neonatal units at the time of discharge. These points many times have helped me in picking up babies and telling parents right in the beginning that your baby looks probably a little deviant and we need to follow it up to see that it develops normally. One of them responds. Whenever you are handling a baby, the baby must make appropriate body response. If you see a baby not making any bodily responses, probably that baby sensorium is abnormal, that need to watch. The cry of the baby, any baby that probably is not vigorous at the time of discharge, is having a weak cry or an abnormal cry or not crying at all. Several times you see babies that don't cry even to painful stimuli. These babies exhibit later days abnormal behaviors. Looking at the spontaneous movement, this is one of the things that you can observe. Many babies make spontaneous movements during the sleep, especially during REM sleep. If you see a baby with absent spontaneous movement, that's also an indicator that baby is probably prone for developmental disorder later in life. Tone is another thing. If you see a baby with generalized hypotonia or pick up generalized hypertonia, indicate the baby is going to probably go for cerebral palsy. Posture is one thing that probably in a neonatal unit will help you tell, is this baby having normal tone? Is this baby having normal sensory? Next slide, I will show you a picture of how to identify this. And two other factors that you need to see is normal sleep-wake cycles. Most times we have scheduled feeding in the nursery and no day-night ambience in the nursery, and it becomes very difficult to observe for this, but one needs to carefully look at the sleep-wake cycles, because if a sleep-wake cycle in a baby is absent, it indicates an abnormal behavior or a deviant behavior. And a baby that is lethargic at the time of discharge, not showing much activity, is also an indicator for surveillance. See this baby, how it keeps all his limbs flexed. This is the normal tone and indicated by a normal posture. If you see a baby having a posture like this, limbs extended or asymmetrically, one side of the limbs flexed and one side extended for prolonged periods of time. For a brief periods time is okay, but if they keep this all the time, which means that baby is abnormal. You need to pick up that baby, tell the parent that baby needs constant surveillance and probably developmental assessment at appropriate times. Now, the developmental milestones are classified under these great larger domains of gross motor, fine motor, language. In language, you have the expressive and the receptive. Then the problem solving, which refers to cognition, and the personal, social, and adaptive milestones. There is a big role for primitive reflexes. Assessment of primitive reflexes give good clues to neurodevelopment delay, or actually give us the early red flag signs as they are developing. Most primitive reflexes begin to occur in utero, that is, they develop through the early months of child postnatal life. But when these reflexes are probably then replaced as they are growing by the voluntary motor skills, which we call that as integration, which happens because of slowly the cortex taking control over them through inhibitory sequences. What do these abnormal or persistent primitive reflexes indicate? See, these abnormal primitive reflexes, if they persist without the emergence of the voluntary activity, it is a clue to that these babies are suffering from a neurological problem. Some of the primitive reflexes that interfere with swallowing and sucking, that becomes evident very early in the neonatal period, because sucking and swallowing becomes early part of the survival instinct. And if you have a moro that is strong, this interferes with the not disappearing. By 12 weeks, you may have problem feeding difficulties in these babies. If there is a persistent tonic labyrinthal reflex, it may cause problems in holding or pushing or feeding of the babies also. Similarly, persistent asymmetric ATNR can cause constant lateral head turning, which may cause problems with feeding and again rolling over. So most reflexes have a role to play in the development, and these reflexes normally need to disappear. There are reflexes that probably appear as the child is growing and stays for some time. And this is the table. I think though they're small, I think most reflexes, this table gives you when it appears, what is the purpose of this reflex, when it should get integrated with the voluntary movements, and what happens if they don't disappear in time or they are deviant. So one needs to examine babies for reflexes also, because these are early clues before babies start showing other gross motor milestones. So now we go to the gross motor milestones. We probably had reflexes in the early days. Now we have gross motor milestone as the child is growing. And you could see the normal milestones that should happen at appropriate intervals, and probably when to call them abnormal. You must understand, it is not an exact date. It's probably a range after which you probably tell them, though we say that neck control should be there by 3 months, but you can wait, but there is no other abnormality up to 6 months before labeling this baby as developmental delay. So every aspect of development has a range after which you need to probably tell there is a developmental delay. And these are some of the gross motor milestones that help you to identify the red flag signs in development. And this is around after 1 year and up to 4 years, what are the normal gross milestones. And I've stopped the red flag at 18 months. If a child is not able to walk alone by 18 months, that's an important red flag signs in his motor development. And I've not put subsequent things because that needs to happen, that 18 months, for the subsequent thing to carry on. And we need to, this one of the very, very important milestones in every babies and in every families to be celebrated. We also must have an eye on the accelerated milestones. We should not be happy because certain milestones are achieved early. That does not mean baby's development is a little faster or very good, because an infant who rolls over before 3 months must be evaluated for hypertonia. Those babies who have persistent fisting at 6 months probably is indicator of motor dysfunction. Or any baby that is keeping the thumb in the thumb in the palm constantly is also an indicator. Failure of these infants to respond to environmental stimuli at any point of time indicates that probably they're having some sensory impairment. I've just highlighted some of the red flags of motor development, which probably not discussed earlier. This is any baby that is sitting in W position most times, not using one side of the body, unusual creeping or crawling pattern like commando creeping or bunny hopping, walking on toes constantly. This is one thing you need to notice. Of late, I've been seeing many babies walking on toes, and I found out one of the reasons after thoroughly going through that, it's not due to some neurological disability in the children, because previously we were taught that was due to tight Achilles tendon. But after 2 or 3 babies whom had a normal developmental screening but still had toe walking, we found that they are used very early in their life, these walkers, in which they put this baby to probably walk as early as 6 months, 8 months, to have their foot to the ground and then just waddling their leg. These babies tend to develop toe walking, and we need to be very careful not to use these walkers too early in life. And standing up from sitting, keeping hands on knees, that is climbing on one's whole self, probably indicates a muscle weakness, girdle muscles that we see in muscle dystrophies. And if a baby is not clapping both hands by 12 months, probably indicates that there are it's a red flag sign in motor development. Then we come to fine motor skills. This refers to the coordination of small muscles and movements, usually involving the synchronization of hand and fingers with eyes, mouth, and also involves dexterous movements and coordinations. So the gross motor movements lay the foundations for the fine motor movements to develop. Without gross motor movements development, you cannot have a perfect fine motor development also. And these are some of the fine motor developmental milestones that you see as a child is growing. And one needs to be thorough with all these things. And some of the important things that we must look for in an office practice is to look for going for objects, the immature princess grasp, by 2 months having a strong princess grab and able to pick up small beads and pellets, and by 15 months able to scribble on your pad if you give a pen in your clinic. And at home, if the parents say that the child is able to make blocks of towers of 3 at 18 months, blocks of 6 at 2 years, and blocks of 9 at 3 years, then you have the other milestone by copying a bridge, cross, everything. And so these are some of the fine motor developments you see that involves the hand, eye, and coordination. Then you have other eye-hand coordination milestones you need to carefully look at. One is the hand regard at 4 months, the hand in midline and by 4 months, the ulnar grasp by 6 months, transferring objects from one hand to another must happen at 6 to 7 months, the radial grasp by 8 to 9 months, and by 1 year, the child must have developed a mature princess grasp. Then we have this hand-to-mouth coordination that helps child to start feeding on its own, and also one of the important milestones the patients normally bring the child for, and probably they try to avoid this. Most child take their fingers and the entire hand also into the mouth. This is normal phenomenon of development, and one should not restrain the baby from doing this. I think sucking of the thumb, sucking of the palms early in their infancy, I think is very good. The sensory stimulus for the brain to develop, and many parents put either mittens to their hands or try to keep pulling their hands away. But one way of discouraging them is to probably play with them and discourage it, not to pull it off. So this is one of the important development, but what you would be seeing in your clinic without asking for needing to test it. And this you need to ask some of the milestones as when they are coming for their regular routine vaccination or their developmental screening. That by 15 months it will be able to drink from cup. By 18 months it must be able to feed with a spoon by himself. Then we have certain ambidextrous fine motor skills where a baby is able to assist you while it is dressing and probably unzipping a zip. Probably you have seen many times in your clinics a baby unzipping the purse of the mother. By 18 months, you know that the baby is developing normal. We need not ask to unzip any of things. You can simply place the purse there and it will unzip the purse. And by 2 years, it must be able to undress and wear shoes and socks. 3 years, it must dress up on its own. 4 years, it must be able to put up its button in the shirt or unbutton the dress. And 5 years, it must have developed the skill of tying shoelaces. So these are some of the personal social milestones that are also part of the cognitive development and adaptive development that the baby gains, manifests or develops as the brain is maturing. By 3 months, it must be able to recognize mother and anticipate feeding. By 6 months, it must be knowing the strangers and have its stranger anxiety expression on its face. By 9 months, must have started waving bye-bye. By 12 months, it should come and call and must start playing simple ball games. By 18 months, it must start imitating parents in tasks. And 2 years, it must start asking for food and expressing toilet urge. So these are
2 minutes, sir.
yes, sir. I've heard it well. I know I'm going to move faster. So these are some of the red flags that are part of fine motor, cognitive, and personal. And you'll see a whole lot of them. Probably it only needs some observation as you are preparing your child for vaccination. Normally, what I do is keep asking parents for many of these questions as what your child has achieved this month, what your child is doing this month. So the parents come out with a lot of this, and it really gives you reassurance as they are enumerating one by one the skills that the child has attained that will help you in the surveillance. And if you see some of them missing, quickly catch them, ask them for more detail. Then you have the one important domain, that is language and speech. I know language is a way of communication and it's very, very important in adaptive and social life. And speech is a part of this language, which represents the verbal form of communication or language. And these are some of the language development you see over as the child is growing: social smile, cooing, laughing, squealing, babbling. By 1 year, it should be having at least one word, or by the end of 15 months, having at least a vocabulary of 10 words. And by 3 years to 2 years, it must be at least combining 2 words and calling some simple commands. And by 4 years, it must be capable of reciting stories. So see the number of the normal development language skills that you see in infant and toddlers. And the red flags: all children with language delays should be referred for hearing assessment. Infants who are deaf may have normal pre-linguistic expressive language until 6 to 9 months of age. This should not give a false sense that the baby is developing normally in its language skills. And some of the red flag signs: no response to sound or voice to familiar persons, does not babble by 8 months, no single word by 18 months, does not use 2-word sentence by age 2 years, does not learn to use gestures of waving or shaking. These are red flags in the language domain or communication domain. Thank you for this patient listening. too big a topic to be compressed in a too short time. And I think the night has come for us to lie down like this. Thank you very much.
Thanks a lot, sir. Thanks. And you proved that you are the king of combining Mahabharata and Ramayana, as your name suggests, as being a king. Thank you, sir. Thanks a lot, sir. We'll take the questions in the end.
Yeah.